Good evening, the chairman of this occasion, fellow pharmacists. Once again, we welcome you to Kwara State. The topic we are looking at is optimizing patient care through technological tools.
Sorry for breaking protocol. The chairman of this session ought to have spoken before the presenter. Sorry, sir.
Good evening, distinguished colleagues. Okay. Thank you. Good evening, distinguished colleagues. Once more, I think we are going into the very sensitive section of this, our gathering. We have just finished the one that any other person can participate. But this time around, it's going to be specifically for the pharmacists in the hospital section. I think we'll do ourselves real good if we come over here and listen to what is going to be talked upon, as the topics are chosen specifically to improve our service at the time we might have concluded our gathering here. So I welcome all of us to this special session, optimizing the patient care, which is what we do on our daily practice, but how do we optimize it to the benefit of our patients and to the progress of the institutions we are working on. We are all welcome. Please give him a very good attention. Thank you.
Thank you, our chairman. Please, can we put our hands together for our chairman? Before we go to Dr. Bello's presentation, I'd like to call on Dr. Adetutu to join us upstage, ma'am. Dr. Adetutu. Please, can we put our hands together for Dr. Adetutu? This car is blocking several other cars. FKJ 282 FL. FKJ 282 FL. Please, several persons are waiting for you to go out. FKJ 282 FL. Dr. Adetutu, you are welcome, ma'am. Dr. Bello.
Once again, I say good evening all. And the topic before us is optimizing patient care through technological tools. And today, we'll be looking at pharmacy apps. The outline of my presentation are introduction, top pharmacy apps, their features, clinical contents, product demonstration, and conclusion. And the objective of this presentation is to create awareness of the top pharmacy app used in clinical practice, describe their features and clinical contents, recognize the app used at the point of care, and discuss how pharmacists will use these clinical tools to optimize patient care. And finally, to encourage pharmacists to start to continue to use this app. As introduction, pharmacy apps are interactive computer programs designed to assist pharmacists with decision-making tasks, usually at the point of care. Numerous apps are available to assist healthcare professionals with many important tasks, e.g. references, information gathering, patient management and monitoring, clinical decision and medication monitoring and training. Research has shown that pharmacists use mobile devices to help serve as clinical references at point of care. It has also been shown that the use of clinical references as point of care tools has helped streamline workflow and increase productivity of healthcare professionals. Many of these references are now available as mobile applications. Mobile devices and house provide many benefits for healthcare professionals. They greatly increase access to point-of-care tools, which have been shown to support better clinical decision-making and improve patient outcomes. This advancement in house and growth in utilization has helped increase patient care and medical safety. Healthcare professionals use medical devices and have for many purposes, most of which can be grouped into the following categories. Number one, drug references, clinical references, laboratory references, and medical calculators. Top examples of this app include Hippocrates, Lexicon, UpToDate, InfamD, Dynamite, Sanford Guide to Antibody Therapy, Macrobic Pro, Smart Medical, and Pocket Value. Then their applications include drug information, medical calculators, drug interaction checkers, peace identification, laboratory references, and patient information repository. Moving forward, I'd like to have a short video demonstration of one of these products, just for 5 minutes.
Our clinical intelligence tool, Hippocrates Plus, is America's #1 medical app. With easy navigation and comprehensive and concise information, Hippocrates Plus is an indispensable tool for today's healthcare provider. Using your smartphone, you can review prescribing and safety information for thousands of drugs, including alternative medicines. Check for potentially harmful drug interactions among up to 30 drugs your patient may be using. Access thousands of disease monographs to help in your diagnosis and selection of treatment. And with Athena Text, you can send secure, HIPAA-compliant messages to your care team, inside and outside your practice. Use our coding bundles to help decipher the America's #1. Check for potentially harmful drug interactions among up to 30 drugs your patient may be using. Access thousands of disease monographs to help in your diagnosis and selection of treatment. And with Athena Text, you can send secure, HIPAA-compliant messages to your care team, inside and outside your practice. Use our coding bundles to help decipher the complex world of ICD-10 and CPT codes. Quickly navigate Hippocrates guideline synopsis for authoritative, evidence-based recommendations arranged by specific patient type. Having the latest curated clinical content in the palm of your hand saves you time and helps you be even more present for your patients in the moments of care. That's Hippocrates.
Life today is increasingly mobile, and healthcare providers require drug and clinical resources that are available at the point of care. With software optimized for a wide range of smartphone and tablet devices, Lexicomp puts these resources in the palm of your hand. Lexicomp content is updated daily and does not contain pharma bias. Our mobile software provides healthcare professionals with the depth of information they need to make informed decisions. Easy to use and intuitive navigation allows users to quickly access the level of resources they need and to provide the best possible patient outcomes. With a proud reputation for trusted content and exceptional technical support, Lexicomp is the first choice in mobile drug and clinical information resources.
Lexicomp's drug and clinical information improves patient safety at all stages of care. Users can find answers faster, stay up to date with changing guidelines, and be more confident in their decisions. Lexicomp is used by a wide range of clinicians across the entire scope of patient care. Physicians and nurse practitioners use our drug information to make informed diagnostic, medication, and treatment decisions. Pharmacists utilize Lexicomp to save time by quickly accessing comprehensive answers to drug therapy questions. Nurses use Lexicomp content to better administer medications and monitor patients. The foundation of Lexicomp's products is the comprehensive drug monographs. Users can quickly access information on dosing, interactions, warnings, and more. Also, dosing for special populations is included. With Lexicomp's powerful interaction analysis tool, LexiInteract, a user can enter 2 or more drugs, herbs, or natural products and access a complete overview of the potential interactions their patients may experience. LexiInteract reports not only documented interactions, but also predicted pharmacokinetic interactions that hold a high probability of occurrence. This higher level of reporting allows LexiInteract users to avoid or better manage problematic combinations, even prior to their appearance in FDA-approved product labeling. Consideration is given to special populations that need extra safeguards. Only in Lexicomp's monographs will clinicians find detailed information for neonatal, pediatric, geriatric, pregnant, and lactating patients. The breadth and depth of Lexicomp's information goes well beyond what's included in the package inserts. More context and guidelines are provided regarding warnings and precautions to assist clinicians in understanding the real risks to individual patients, as well as the appropriate steps to minimize those risks. Too often, free resources fall short in this area, and incomplete information is utilized when making critical decisions. Links to PubMed are included within the product, allowing quick access to abstracts and other sources for secondary research information. Other special topics addressed by Lexicomp's mobile content include chemotherapy regimens, REMS, clinical practice guidelines, and special alerts. Additionally, Lexicomp provides content that addresses topics outside of drug reference and pharmacotherapy, including disease, labs, poisoning and toxicology, natural products, and pharmacogenomics. For convenience, performance, and speed, Lexicomp's content is stored on the user's handheld device. This means they will never lose access to important clinical information, even when a cellular signal is unavailable. Daily updates of the latest warnings, special alerts, and new drugs can simply be downloaded through a Wi-Fi network and only take seconds to complete. Software is available on a broad range of smartphone and tablet devices, including iPad, iPhone, iPod Touch, Android, and others. For whatever mobile device used, access a free trial by visiting www.lexi.com. Start using Lexicomp today and experience the most detailed information resource available for smartphones.
What I believe is that the digitalization of academic drug information centers is coming, and we just happen to be the pioneers of that movement. Informed is your mobile drug information center, powered by Mercer University's Drug Information Center, based in Atlanta, Georgia.
Each of our requests begins with a comprehensive literature search to find all of the information that pertains to the topic. From there, we'll narrow it down to find the best of the information, typically the randomized controlled trials. We will then summarize all of the information into a document for the requestor. From there, we will send out the information to be peer-reviewed, and we will also have a pharmacist do a review over each and every request before it is sent out to the requestor. Our ultimate goal is to give all of the information our requestor needs to make a properly informed decision.
Not only does our service promote evidence-based information to healthcare providers as well as patients, but also internally, this is a wonderful teaching opportunity for our residents and students, really to learn valuable skills such as literature searching or literature evaluation or communication. The mission of Informed is to promote the free flow of evidence-based information through teaching as well as service.
In studying the history of medicine, there have been some major turning points throughout time, such as the stethoscope in 1816 or the X-ray in 1895. Now we're entering a new era in the digital age where we have unlimited possibilities, all digital.
Through the support of the Informed community, eventually this tool will become an integral part of every healthcare conversation that involves some combination of the healthcare provider, patient, and learning practitioner, all working to ultimately promote the quality of care.
UpToDate is designed to answer your clinical questions at the point of care. The following features and shortcuts will help you find the answers you need quickly and easily. As you begin to type in a disease, symptom, lab abnormality, or drug, UpToDate will suggest a list of terms to save you time. Simply click on the term you're searching for and a list of topics will appear in order of relevance to your search. Use the top navigation to easily filter your results by adult or pediatric topics, patient information, or graphics. UpToDate provides patient education materials written at 2 reading levels so you can choose the most appropriate for your patients. UpToDate provides a variety of photos, tables, charts, and algorithms to help you quickly make decisions at the point of care. The most commonly referenced content is highlighted beneath each topic to help you easily access the information you need. Hover over the arrow to the right of each header to browse a more complete table of contents. Simply select the heading that interests you to immediately jump to that section of text. Throughout the UpToDate topic, you will notice links to drugs, graphics, related topics, and references. Simply click on a reference to read the Medline abstract. Click on a drug name to learn more about dosing and administration. UpToDate, in partnership with Lexicomp, includes more than 5,600 unique adult, pediatric, and international drug entries. The link to the summary and recommendations is always conveniently located at the top of each outline. UpToDate is transparent about the quality of evidence behind our recommendations. Throughout the text, you will see evidence grades. Along the top right navigation panel of UpToDate, you will notice a few shortcuts. In What's New, UpToDate shares important new updates by specialty. Simply choose the area you are interested in to see updates from the past 6 months. In Practice Changing Updates, you will see updates to our content that have an immediate impact on current best practices. Medical calculators can be found throughout our content. We also present them here by specialty and alphabetically, so you can quickly find them for use at the point of care. Our drug interactions database, powered by Lexicomp, allows you to enter a list of prescription, over-the-counter, and natural drugs your patient is taking. Hit Analyze to learn about their risk for interaction. If English is not your native language, you can update your preference by clicking Language in the top right corner. This will enable you to search in your preferred language. Search results and UpToDate content will still be presented in English. To get to clinical answers quickly, keep these features and shortcuts in mind as you begin to use UpToDate in your practice.
Yeah, thank you for being. Like we said, the focus of this particular presentation is on the top pharmacy mobile applications. We have listed some that includes lexicon, Hippocrates, up to date, infirmity, and we have seen the video demonstration. We have equally talked about the various categories and their applications. And the purpose of this presentation is to encourage us to continue to start using these applications, or to, if you have not started using, to start using them. So we have seen lexicon, we have seen Hippocrates. Let's go forward to see other useful apps that we can use at point of care. We have Medscape. Medscape is a free app that offers resources on various medical topics. The app's drug information has over 8,000 monographs on the medications. And international checker is included that can analyze up to 30 medications at once. It also has medical calculators, and lastly, Medscape provides medical news organized for pharmacists. Next is InfirmD, which I have seen on video, and up to date, you have probably seen that. We have sample guide antimicrobial therapy. This mobile app provides digital access to one of the leading references on microbial therapy. The app incorporates internal calculators for the dosing of antibiotics that may help practitioners reduce time taken in making therapy decisions. Since 1969, Sample Guide has been a leader in point of care recommendation for treatment of infectious diseases. Widely used by pharmacists, improve patient care by providing careful, curated recommendations on the latest evidence. Coverage includes clinical syndrome, pathogens, and anti-infectious agents. Specialized dosing tables and tools are equally included in this application. Then we'll move on to Microbe Pro. This provides clinicians and pharmacists with a broad range of resources to facilitate empirical therapy on infectious diseases. They have fully integrated local guidelines, local antibiograms, and pathogen prevalence to help clinicians select the most appropriate empirical antimicrobials. They have resources suitable for hospital and healthcare centers to deliver institution guidelines to their own clinicians. They have way help clinicians increase the chance of a successful clinical outcome, help escalate antibiotic use. Next, we have the Pocket Lab values. This app has over 320 laboratory test values split into different medical categories. A bonus feature of the app is that it gives the ranges of appropriate values along with information on what may cause value to be high or low. We have a Smart Medical. This provides laboratory value, clear, concise coverage of 500 plus of the most commonly performed laboratory values, organized by body system, lab panels, and drugs, symptoms, and diseases. It also has a drug information database, diagnosis test procedure, differential diagnosis, and medical calculators. In conclusions, mobile medical apps are quickly becoming one of the most important tools in clinical practice. They are efficient and convenient means to provide real-time medical information at the patient's bedside, assist with diagnosis of disease, help patients manage their medical conditions, and serve as educational tools for clinicians and patients. Medical devices and apps are already invaluable tools for healthcare professionals, and as their features and use expand, they are expected to become even more widely incorporated into nearly every aspect of clinical practice. Hospital pharmacies are therefore advised or encouraged to leverage this app and their evidence-based clinical content to optimize patient care. Thank you. I'd like to acknowledge the following people: Dr. Uche Ndevo for our contribution, and Dr. Assis Advani for his own contribution too, and Dr. Raji, an expert on lexicon, and pharmacist Ayobami Diallo, an expert on Makobi Pro. My references. Thank you.
Thank you, Dr. Ike Bello. Please, that clap was not for Dr. Ike Bello. Please, can we put our hands together for Dr. Bello? Thank you, sir, for that wonderful presentation. I'll now hand over the microphone to the chairman to call the next speaker.
Thank you. I think we should appreciate the first speaker more because he has been able to do something. He said in the morning we had advancing technological revolution in pharmaceutical service delivery. At this session, there is a breakdown of those topics that was given to us in the morning. This had the case of optimizing patient care with technological tools. And Dr. Bello has given a good breakdown of that. The purpose of this is that by the time we are living here, we should be having a change in our practice in our various institutions. We are going to call the second speaker to come on the podium, and he's going to take the topic e-dispensing and digitalization in hospital practice, hospital pharmacy practice, new frontiers in patient care. And we are going to have Dr. Mrs. Adetutu from National Hospital Abuja, who will do justice to that. Let's give her a rounding applause. Thank you.
Good evening, ladies and gentlemen. Please permit me to stand on existing protocol. My name is Adetutu Ajemi Bishe, and it's my pleasure to deliver this lecture titled E-Dispensing and Digitalization in Hospital Pharmacy Practice, New Frontiers in Patient Care. Please, I hope you can hear me clearly. Okay, thank you. So this is the outline. We'll have a brief introduction talking about this subject, then look at e-dispensing, digitalization, the advantages, the challenges, and then we will conclude. The advent of the internet and the use of information technology systems have greatly widened the scope of the services that pharmacies offer. This has improved efficiency in what pharmacies serve, how we serve clients, and the storage of patient information, and has facilitated electronic prescribing, electronic dispensing, administration of medicines, and so on. IT has also contributed to the automation in the way we handle medicines in the supply chain and provide tools for monitoring the efficacy and safety of medicines in use. By optimizing the use of computer technology, the hospital pharmacist is assisted in keeping all relevant data needed in providing oversight of a patient's medication therapy, especially for documentation. We know that in pharmacy, we have a saying that if it is not documented, that it's not done. So for all those processes that require documentation, prescription documentation, vetting, pharmaceutical care, even in research and clinical trial, computer technology has greatly improved the efficiency. Now, handwriting interpretation errors. I'm sure as hospital pharmacists, we have encountered quite a number of these in our practice. And it is said that this causes about 9% of all medication errors. Now, when you look at the volume of prescriptions that is handled in the hospital, you will know that this is quite significant. Computer-assisted prescription writing helps to lower these errors and promote rational use of medicines. Although electronic prescribing is not yet a requirement in Nigeria, it is well underway in the developed countries, like in the USA and in many of the European countries. National healthcare improvement organizations recommend the use of electronic prescribing applications in pediatric practice because it has been noticed that the pediatric specialty, amongst other specialties, has a high propensity for medication errors. Now, traditional dispensing involves the use of paper. And we know the issues that come with storing these papers, keeping them safe over years, and the problems or the challenges that can come when we want to retrieve information or follow a trend. The work that is involved in going through cartons and cartons of prescription, and sometimes some of this can be torn or eaten up by rats or termites and the rest of them. So e-dispensing helps to overcome some of these challenges. Now, e-dispensing is defined as the act of electronically retrieving a prescription and reporting on giving out the medicine to the patient as indicated in the corresponding e-prescription. Before e-dispensing can take place, there must have been e-prescription by a healthcare giver legally authorized to do so. E-dispensing protocol should be in conformity with the original standards of traditional good dispensing practice. So that means that even though we are promoting e-dispensing, all the traditional practice for good dispensing practice, that is saying that the dispensing area is clean, neat, and we pay attention to take the right drugs and give to the right patient, are still maintained. Now, electronic dispensing tools help pharmacists accurately dispense medicines by collecting, managing, and generating the necessary data. And examples of data that we can generate are: 1, patient profile and medicine history. It is so easy to generate from e-prescriptions. 2, medicines inventory. If you want to know the trend of which particular medicines are used or dispensed, it can be easy to get. And then statistics needed for management decisions, like stock take, how so-so medicines are consumed within a so-so number of months or time. Software quality is integral in the execution of e-prescribing and e-dispensing. Software vendors abound, but it is important that the pharmacy department selects a vendor that understands your processes and gives you a software that can well translate your processes into digital form that is profitable for the pharmacy. Software vendors are required to meet some requirements developed by government regulatory agencies. We don't yet have such regulatory agency in Nigeria, but an example is the Australian Digital Health Agency. Records that are stored in these systems must be searchable, filterable, retrievable by categories, by patients, by prescriber, by drugs, by pharmacy outlets, and so on. Now, talking about digitalization in hospital pharmacy practice, what does this mean? This digitalization involves developing and implementing digital technologies at all levels of operations in the hospital pharmacy practice. Now, it is important for us to understand the difference between digitization and digitalization. Digitization is the conversion of data from analog to digital formats. For example, I have a piece of paper in my hand now. I can scan this piece of paper or take a snapshot of it and send it by email. That is digitization. I have converted it from paper to digital format. But when we talk about digitalization, we mean converting the whole process, the whole business process, to use digital technologies instead of analog, offline systems such as paper or whiteboards. That means that from the initial process, you use digital technology instead of having to write on paper at all. So that is what we mean by digitalization. Now we come to the very practical aspect of it to see how this functions. And I'm going to use my hospital, National Hospital, as an example for us to understand how e-prescribing and e-dispensing takes place. Now, like we said before, for e-dispensing to proceed, e-prescription should have been written by a physician authorized to do so. And an e-prescription should contain the following: a unique prescription number, the prescriber name, qualification, practice address and telephone number, date and time of issue. Now, looking at the prescription to my right, we find there, towards the bottom part of it, the doctor's name and qualification, the date and the time. Now, unique prescription number is not yet a feature that has been included in our hospital, but temporarily, the patient's hospital number serves as a unique prescription number, because we know that every patient that attends a hospital is given a hospital number that is peculiar only to that patient. Also, there must be patient's full name, address and phone number, patient's date of birth or age, the name, strength, dosage form and quantity of the medicine, adequate directions for use, and number of repeat supplies. Still looking at the prescription on your screen, you will find the patient's name is there, though it is blocked. We have the patient's sex, a female, the age, and then we have the name, the strength, and the quantity of the medicine. In this case, we are talking about olopetamide 0.1% eye drop. 1 drop into the eyes 3 times a day for 28 days. So this is how an e-prescription appears. Now, moving on. A dispense record should also have some important information, and it should contain the full details of the prescription, the date and time on which the prescription was dispensed, the name of the pharmacist who personally dispensed the prescription, and then the pharmacy outlet name. Now we come to the software that we are using in National Hospital, and it is called Health in a Box. Now, e-prescriptions are generated from the prescriber end, just as we said. After the prescriber has interfaced with the patient, and if he wants to write a prescription for drugs, he clicks on the tab that is pharmacy, and the window that is next to your right, to my right-hand side, shows us the drop-down menu that comes out, listing all the medications in pharmacy department. So all the doctor does is to click on the particular medicine that he wants the patient to have. So once that is done, he clicks save, submits, and next, at the pharmacist end, this e-prescription is displayed when the patient comes to the pharmacy. So all the pharmacy needs to do is to collect the patient's hospital number, impute it into that window, and all the information about the patient comes down to the right-hand side window on my own screen here. So from there, the pharmacist retrieves and ensures that the particular date for this prescription is entered, because we know that patients can come at different times to the hospital and get different prescriptions. So it is important that you check the date, and then all this information is displayed in the pharmacist end. Now, this point is where all that is important for pharmaceutical care to take place. The e-prescription is retrieved, and the pharmacist checks for correctness, writes all the right dose for the right frequency, for the right period of time, and checks all the necessary information that should be included. If there is an issue of concern in which the pharmacist wants to discuss with the prescriber, there is an icon like a bell on the top part, on the top middle part of that e-prescription. The pharmacist clicks on that icon and it alerts the doctor, because it's like a chat box, and the pharmacist can write or say whatever he or she wants to discuss with the doctor. So when all those is cleared and the pharmacist is satisfied, he clicks on the submit button, and an invoice is generated. This invoice contains all the patient's information, plus the drugs that were dispensed, and the amount, total amount that all this come up to. So in this particular case we are looking at, the total amount is 945 naira. So the pharmacist prints out this, and then the pharmacist prints out that invoice. The patient takes it to the accounting section where payment is made, which is displayed here, though the pharmacist has nothing to do with this. And when payment is made, at the payment point, a receipt is generated and given to the patient, who presents it to the pharmacy. That receipt has a unique number, which the pharmacist carries, looks, the unique number, types it into this window, and at that point, e-dispensing takes place. That means that the computer automatically deducts the drugs that have been paid for from the pharmacist's stock. So when that is done, the pharmacist now comes to, when e-dispensing is done, the pharmacist now does because it has been deducted from the stock, the pharmacist now comes to physically count the medications, and the computer generates labels automatically, auto-generated labels, by prompting the pharmacist drugs dispensed successfully. So the pharmacist now takes this label, checks for correctness, and takes this label, because it comes as stick on. So it's able to be removed, and the pharmacist sticks it on the already dispensed medication, either bottle or envelope. And at that point, patient is counseled and the patient leaves. That is e-dispensing. Now we said that a software, you should be able to retrieve information. So this page, these windows that are here, gives an example of information that can be retrieved. For example, in this case, we are concerned about patient drug history. We want to know for a particular patient the medications he has taken in the course of a particular time, maybe June 1 to June 30th. So we ensure that the start date is put there, the end date is put there, and you click submit, and automatically the report is given on the right-hand side. All the medications that the patient assessed for that period is given out. This is just one of the records you can get. You can want to know the stock balance for any unit. You can want to know the movement of a drug of concern, maybe narcotic or controlled drugs. By the clicking on the system, you can ask the computer, you can give the computer a query of what you want, and it automatically downloads the report that you need. So this is just an example of a workstation of e-dispensing in the pharmacy. As you can see, there is a monitor displaying the logo of National Hospital. That is a health in a box software that we are using. This monitor is attached to keyboard where you input your information, and next to the monitor to my right, you have the invoice and the receipt printer and the label printer, such that the workflow just goes on easy like that. And there is minimal use of paper, which is what we say is digitalization. Now, what are the advantages of this e-dispensing and digitalization? There is improved workflow and reduction in the complexities associated with the dispensing process. There is reduced prescribing and dispensing errors. There is improved patient safety by reduction of adverse drug effect, because it is possible to also have some software that can alert if there is supposed to be an incidence of drug-drug interaction or adverse drug reaction. It will give an alert, and the patient and the pharmacist can, of course, pay attention. Pharmacists also have more time to focus on critical aspects of our pharmaceutical care. Also, like we said, there's improved documentation. There's reduction in the incidence of drug abuse or drug diversion, because the system will automatically alert if there is a duplication of prescriptions. It can also help limit physical contact with patients, especially in this era of COVID-19 and cholera. And then, of course, there is enormous data that can be produced from this IT to help in supply chain management, safety, monitoring, and so others. Challenges which are important is the financial cost ab initio, because the cost of purchasing, implementing, maintaining, and supporting the hardware that is used can be high, but there is return on investment over time. Also importantly is change management. We should never underestimate the change when we are set in our ways. When staff or hospital personnel, pharmacists are set in their ways in doing things using paper, it can be a challenge to get them to move away from one way they are used to another. And because people also have different technological abilities, it can be a challenge. But with education, over time, people buy into. Also, there is hardware and software selection. The kind of hardware and software that needs to be selected for these processes, you have to pay attention. And it's not just at the initial point, but the sustained support of this IT personnel, so that you can continue to use these things meaningfully, is also important. And then integrity of data input. We're all aware that garbage in, garbage out. Pharmacists should be aware of the new kind of errors that can occur with the use of technology. Errors such as clicking or selecting the wrong patient or the wrong choice of drug in a menu if you are not paying attention. So all these things are important for us to know the new types of errors that can come in. And there could be temporary delays in arrival of e-prescription. There could be system failure or downtimes when the network or the hardware fail or there is no electricity. So you need to make backup arrangements when these kind of things happen. And importantly is security and privacy concerns. We know that patient information should be kept privately. Patient information are important for us to keep. So we want to limit the access of people who can access this patient information, or even those people who hack into systems to do harm. So every institution should make provision for the protection of patient information and the use of firewalls to block the activity of hackers. Before I conclude, I just want to talk to us a little bit about the future outlook in e-dispensing and digitalization. We are now looking, well, I'm going to take us quickly through two aspects: automated dispensing systems and robotics. This is just to say that machines are now being used to improve patient safety and documentation, and they are things that are going on in other parts of the world, and we hope that very soon will also come to Nigeria. The first one is this automated dispensing system. On my left is the KL60 Kirby Lester automated dispensing. Here we see a pharmacist who is at one end of the system before the computer, imputing information, giving directions, and the computer is attached to a series of cells in a cabinet, and automated dispensing takes place. And all the information that is imputed per patient is individually dispensed, prescriptions are filled, and conducted back to the point, the front part where the pharmacist is. And the pharmacist can just retrieve this and send to the ward or give to the patient. So this is automated dispensing that is already taking place in parts of the world. And secondly is dispensing by robotic system. So we have my friend here, Bala, who is a robot and who is able to dispense faster than what any human can. By use of computer, information is sent into this special room where this robot is kept with drugs arranged by the robot, so that when information is given, it can go up, down, side, move any direction at a speed that humans cannot compare with, and bring out the prescriptions, and through a conveyor belt, move them outside the room where the pharmacist can use them or give them to the patients directly. So in conclusion, e-dispensing and digitalization is technological innovation that is transforming the hospital pharmacy practice and has great potential to mitigate the issues associated with paper-based prescriptions and medication errors, plus documentation. This is very important. So whether from patients to physicians to pharmacists, e-dispensing and digitalization promises better coordination of care, improved clinical practice, accountability and communication across the healthcare continuum. However, necessities must be put in place before digitalization of these processes can happen. I want to use this opportunity to acknowledge the assistance and contribution of Pharmacist Joshua Romosele, Pharmacist James Peter, and Mr. F. Young in Health in a Box in our hospital, especially for the pictures and the information they helped to supply to make this presentation very robust. These are my references. Thank you very much for listening.
Please, can we put our hands together for Dr. Mrs. Adetutu? I'll hand over the mic to the chairman of this plenary session, sir.
Thank you, Dr. Adetutu, for giving us a leadway in this topic, e-dispensing and digitalization in hospital pharmacy practice, new frontiers in patients' care. It is said paperless prescription must be followed with paperless dispensing. And so the chain continue. Thank you for giving us a light on that topic. Quickly, we are going into discussion period, and we have two discussants to share more light on this topic. The first discussant is Pharmacist Shehu Malagi, FCM. And second is concerned is pharmacist Unjalo Tarugwa, LPC Farm. They are going to have 5 minutes to give a breakdown also on these two topics that has been given to us this evening. The first is optimizing patient's care with technological tools. And the second is e-dispensing digitalization in hospital pharmacy practice, new frontiers in going to have pharmacists who are Tahiru to take the lead. Shall we put our hands together for him?
Chairman of this section, distinguished colleague, I need to start the existing. The background as well on the topic under discussion, and then the presenters have actually done justice to the topic. I will just shed more light on some of the things that I've highlighted. Optimizing patient care through technological tools. This, you agree with me, that can only be achieved through multidisciplinary approach. Because when we discuss issue of applications, probably pharmacists may not be able to design software that we may need ICT technologies to also come. We may just be able to feed in some information into the softwares that are designed. It is also very important that for us to take note that today we are here and some of our colleagues who are able to be here are also getting information on what we are doing virtually elsewhere. So adding technology to our practice is a way forward to achieve optimum patient care. For instance, when you talk of telemedicine and telehealth, somebody can be somewhere, your patient or a client can be somewhere and you contact you through the phone, give you information of what he or she is feeling, and even you are also going to be able to give counseling through your telephone. Again, you can also monitor your patient very well if you have applications that will be able to, you'll be able to contact your patient, probably the one that is, you have diabetic patient on treatment. You will get to know, maybe I'm on social medications, you'll be able to know the full blood count, fasting blood sugar of that patient. At that moment, you'll be able to know whether to change medication or to add dosage. Again, this will also guide us, help us in collecting data where you are able to know which drug, at what time your drug, if you are running short of a particular drug, you'll be able. Some people find it difficult to generate a report, even at the end of your practice. Maybe say monthly report, you are finding it difficult to generate. These softwares will be able to give you some information. And this also can be achieved through secure messages, which it can be through SMS or through WhatsApp and so on and so forth. And you'll be able to pass. These days, you can also train computer to be able to, maybe when you take picture, you scan it through the computer, and the trained computer will be able to give you information on the skin. Maybe if it's a skin lesion that is supposed to be on so thing, and you'll be able to also add value in that area. So let me also say a little thing about e-dispensing. Like the speaker have also said, you cannot achieve e-dispensing without e-prescription. And this has offered a lot of advantages to pharmacies and other healthcare practitioners. Now, by the time you look at the other area where you have automated dispensing, and then you have machines dispensing drug as if it's ATM machine, where you can also go to pick your cash. Patients can also go to pick their drug through that. Again, the challenge that this may give us as practitioners, it has made your work very easy. Some of us will look at it, okay, what then do you do as a pharmacist? This now calls for the fact that you need to imbibe pharmaceutical care so that your role will not be taken over by machines. Otherwise, some of us will start losing our jobs because where you need like 5 pharmacists, they tell you that 2 or 3 pharmacists will be able to do the job. And this, as much as the advantages that it has given us, again, very importantly, I think we should say this. This also make it easier for prescriber to know which drug is available in your stock through e-prescribing. You know what and what drug that reduce out of stock and medications in your store. Because probably you are going to give information, there are other alternatives that are available. You can see that through the system. And you don't need to cram your dosage form. It's already programmed that you will be able to know even the interactions and possible side effects and so on and so forth. So with this, I think I'll give room for the next person. Thank you very much.
Thank you, Pharmacist Shehu, for giving a light or a kind of breakdown again so that we'll be able to assimilate this topic very well. The next discussion is Pharmacist Njalo Terungwa. Thank you. Let's give him a round of welcome.
Yes, thank you, Mr. Chairman. I wish to thank the presenters for very wonderful presentations they have made here today, and also my co-panel discussants. Yes, my thoughts on the 2 presentations are very brief. As we all know, innovation, health innovations now have become imperative, and they are with us. There is no need overemphasizing their importance in our everyday life now, because almost everyone now uses a smartphone. We know the benefits that we are deriving from the use of these technologies. Now, I'm trying to apply it in patient care and to see how we can optimize the patient care is what we are looking at. And practically, we'll see that there are a lot of benefits that can be derived from it. Let us shy away from looking at the negative aspects. Yes, for instance, the area of robotics, which might appear as if it's a threat to us, that it might take away our jobs, but then that is if we are not ready, we are not prepared. But I believe that the knowledge and skills that we possess, robots will only assist us and aid us in doing our jobs better. Now, the technological tools would assist us. The apps, yes, have been mentioned. There are a lot of devices like blood pressure monitoring devices now that are intelligent enough that if they take your blood pressure reading, some can take like 3 blood pressure readings and automatically calculate an average for you. You have glucometers now that can test your blood sugar level. When you test your blood sugar levels, these records are kept. This is what these devices help us with now. All this data is now saved, and an analysis can be carried out. They can easily analyze all the data that has been imputed and generate reports for us. This aids the prescribers in taking decision, and even us too, as pharmacists. Let's look at the e-dispensing and digitalization. This is also another very good area. But just like the presenter stated, it has to start, the foundation of it is with the electronic health records. Everything has to be digital. The entire system, from the beginning to the end, needs to be digital for it to work. And I want to go on a different tangent here. We know the challenges we have in our own environment. Electricity is still an issue. Now, for these systems to run and work effectively, they require electricity 24/7. This is a challenge that needs to be overcome. How do we overcome it? I think one of the ways would be by perhaps harnessing other energy sources, which we have in abundance here in this part of the world, by using solar systems, so that they can at least augment the public power supplies that we have. Now, we can also look at areas of the benefits of the e-dispensing. Prescription legibility is a very big issue, just like it's been stated. More often than not, a lot of prescribers just scribble something down and you are not able to see it. Even as very experienced pharmacists, sometimes you need to go and ask a colleague, to help you confirm. You might feel, yes, this is a medication that has been written, but you are not so certain. But then, when a colleague confirms it for you, using some other parameter, sometimes you look at the dose and some other thing to help convince you that, yes, this is what the prescriber has actually written. That is if you don't have to go back to ask him what he actually wrote. But with the e-prescribing, that will be taken away, because everything has been imputed into the system, and all what the prescriber needs to do is just to click on it. And if he clicks on it, it is clearly written there for you to read. The digitalization system too is going to help a lot for me in logistics management, in managing your stock, right from when you procure it, you impute, and even after you dispense, that particular product is taken off the shelf. It keeps counting. And so you can easily know your stock balance at any time T. And just like it was said before, even the prescribers know what is available in the pharmacy, so that they tailor their own prescriptions to that particular, the drugs that are available. Let's say in a particular class, you look at the antibiotics that are left, and so on and so forth. So it makes it easier so that there is no OS at all, and it enables the managers of the pharmacy to also reorder, to restock as often as possible, because they would have set a minimum level for the stock, so that when it reaches that level, they are now placing orders for more stock. So thank you so much. These are just my thoughts on the practical issues.
Thank you, Pharmacist Mujalo, for also giving a good breaking down of those topics. At this session, we'll quickly go into the audience. You may want to ask or make comments or even make contributions to these two topics that has been presented to us this evening. This is the time. Please, let's quickly do it because another session is coming up for the comfy members. Thank you. Yes.
Permit me to observe the already established protocol. Thank you, the two speakers, for your informative presentations. But my questions are directed to the second speaker. Please, ma, I want to find out, during the course of your presentation, you talked of patient drug history, that recourse is made to the patient drug history. So I want to find out, do pharmacists have access to patient medication records to correlate with the prescribed drugs, apart from the patient drug history? Because right now we're in the era of pharmaceutical care, and we cannot just say, okay, look at the patient drug history to make sure that those drugs are actually prescribed for the condition the patient presented with. That's the first question. And then, secondly, we keep on saying that e-prescribing and e-dispensing actually reduce medication errors. Please, I want to find out, has any research been done to correlate this? Thank you.
Any other question? We'll take all the questions.
Good evening, colleagues. My name is Pharmacist Hafsat Abdullah. I have a question for Dr. Adetutu. In your presentation, there was a slide on a computer with you wrote receipts, printing, that there's a machine for printing receipts and invoices. So I was wondering, where the patient, is it that patients are paying at the pharmacy or the machine? Is it for, I don't really get the slide. That's the machine, you talked about that is for printing receipts and invoices. So I need a clarification on that. Thank you.
Any other question? This should be the last question. This should be the last question, right?
Hello. Sorry, after this person, we have a colleague here. Maybe that will be the last person. Thank you.
Okay. Thank you, presenters. I just want to ask, what can a pharmacist do when you have problems with these systems? I'm directing this question to Dr. Adetutu. In my facility, they introduced a e-health platform. In that e-health platform, you are limited as a pharmacist. And from experience with several hospitals I've worked with, pharmacy is like an afterthought in some of this software. The software really can't really help you to do certain things. All you just have to do is view your prescription, dispense, and that's the end. You can't do pharmaceutical care. You can't assess patient history. You can't, in my facility, there was an incident. A patient had some, I needed to go back to previous histories. I couldn't. When the complaint was made to the software developers, they were like, no, this is a standard. We are going by the international standard and what. It's only the doctor that have this, rights in this software. And from this software, there are certain other documentations you do as pharmacists. Like in my place, we do patient data statistics. We also do things like encounters. The number of patients you see, the number of antimicrobials you give, the number of antihypertensives, number of stockouts, and all those analyses. We do that to help our practice, but in some of this software, you can't
go straight to the question.
So
go straight to the question.
What can we do in such situations as pharmacists?
So who is the last? Okay.
Thank you so much. I'm Mrs. Akinwande from Oyo State. I want to appreciate the two presenters for those beautiful presentations. However, when Dr. Adetu was speaking, she talked, as somebody said earlier on, he laid emphasis on the advantage of this dispensing medication error. Do we have any research done on this? That somebody can just present to an August out like this so that we'll be able to know that actually what we are saying theoretically is actually practicable. That's one. Secondly, it's just an appeal. These two presentations are very, very fine. And if you look at what is happening now, the in thing now is this e-prescribing and e-dispensing. Then this technological aspect of the pharmacy. Can we have this presentation forwarded to us so that we can leverage on it and study further to also advance in our own area of practice? Thank you so much.
Okay, thank you. That shows that you had given a good listening ears and you follow the presentations. So this time we'll give the microphone to the presenters to respond to the questions raised.
Let me start by thanking you people very much for your questions. It showed that you were listening and following. And I think that's what a good teacher likes, or anybody who wants to bring out information. Now, let me start with the medication error reduction question. Now, we know that when we talk about medication errors, we are talking about prescribing errors, dispensing errors, administration errors, monitoring errors. Now, if we narrow down on this prescribing errors alone, there are many things that define or come under prescribing errors. For example, incomplete prescription writing is a prescribing error. I'm sure in the practice place, we come across prescriptions that are not filled completely, either with the patient information or the prescriber information or adequate filling of name, drug, dosage, strength, duration, frequency are not there. So when we say that it helps to reduce this, it means that the computer is structured that all this information have to be filled ab initio. Without them, the prescription is not complete and cannot be submitted. So it has helped to eliminate all those ones. Is that clear? So the situation whereby you want to identify the prescriber is already taken away. The prescriber is prompted to make sure that he fills all the information that is necessary to be filled before the prescription can be submitted. So in that way, it has reduced prescribing errors. Do we understand? And also on the part of the pharmacy, when the prescription is retrieved, you have opportunity to look at the prescription and check for correctness in all the areas that concern our pharmaceutical care. For example, you check for the correct dose for the patient's age or other information. Do we understand? So it helps to reduce all those ones. And in the system that we operate, the software we operate in National Hospital, I called our attention to a bell icon on the top center part of the e-prescription. Did we notice that bell? So that bell is, when you click on it, it's an icon to alert the prescriber if there is a problem. So when you click on it, it brings a drop-down menu and you can chat. It's just that it was not possible to take a picture of that. You can chat. So on the other side of the prescriber, he gets alerted because he sees a chat from the pharmacist saying, Dr. Bello, can you please cross-check the patient's dose for this particular medication? Officially, it shouldn't be beyond 20 milligram per kg, and this patient has 60 kg, meaning that the maximum dose, or whatever you want to discuss. So it makes a provision for discussion outside you having to physically get up and go to the to the prescriber's clinic. So these are the features that we say helps to reduce. But of course, e-prescribing and digitalization is a new development in patient care in Nigeria. And I expect that people should start looking for how to study it and compare it, and we'll get data. But if we are working with information that has come from other climes, there is plenty information in literature to show that it does help reduce all these errors. Is that answered, please? And then somebody asking about paying at the pharmacy. That is how the receipts, you saw the workstation, that there is a printer for receipt, a printer for invoice. What happens in the pharmacy window is that the pharmacy, when the prescription is retrieved in the pharmacist's end, the medications the patients are to take are displayed. And at a point, the cost of what has been prescribed is also displayed. For the patient to now go and pay, it's not going to be done in pharmacy. So the pharmacy has to print out the invoice, and the patient goes to the account and pays. At the account, there is receipt that is also printed out and given the patient, which he brings back. There is a unique number on that prescription, on that receipt, which the pharmacy imputes into the window where the patient's information is. And it is at that point that e-dispensing automatically takes place because payment has been made. Do you understand? So it's not like it's in the pharmacy that the payments are made. They go to the accounts. The accounts gives them a receipt of invoice with a unique number. And it is brought back to pharmacy. And when it is imputed into the patient's window, automatically the system deducts those medications from the stock balance. So then the pharmacist can now physically dispense them. And then the labels are automatically generated and the pharmacist sticks them on. Does that clarify? Yes. And then there's a question about having access to patient information, whether you can do pharmaceutical care if you have sufficient access to all the information. Now, the software that we use in our hospital, you can actually have access to some types of information. Not everything. Like I told you, patients' information even though it is in the system, we do not want every personnel to have access to them, because some people can be dubious and use patients' information, send them to other organizations or anywhere else that they don't have any business knowing what is happening. So we have some access. Like I said, it's a work in progress. It's still a work in progress. But we have a team in my hospital, the pharmaceutical care team, that still go to the wards and follow up on patients. So much of the access we have in pharmacy is on the patient's medication. Patient's medication and maybe some limited information, diagnosis and the profile of the patient. But some other areas like laboratory results and so on, we don't have access. So we still need to physically follow up. You understand? And I think that is still good, so that you don't allow people from any direction to have access to all patients' information. I guess a time will come that you will be given some specific access with authorization if you need an information for official purpose. Do you understand? But right now, there's limited access, so we still have to do the physical moving up to check up on whatever we need. It's all for protection. We keep improving because this has been going on since 2018. We keep improving, we keep interfacing, and I guess we'll get to a point where things will go on much better than we're having it now. I hope I have answered all the questions. Thank you very much.
Thank you, Dr. Adetutu, for responding to the questions raised. It's like all the questions were directed to Dr. Adetutu. I don't know whether Dr. Bello has something, a little to contribute. Do you have something?
I didn't really have much, but I will only encourage other hospitals to copy them, because most of the places they want to go e-prescribing and e-dispensing, but they don't have the capacity to do that. That's the best standard to reduce medical error. That's my only.
Thank you very much, sir. I think at this point, I want to thank all our discussants, the speakers, and you, our distinguished colleagues there, for making this session a huge success. Shall we put our hands together to encourage ourselves? Thank you very much. As pharmacists, please, we should strive to catch up with technology. We should not allow technology to put us behind. Thank you for this session. All right.
Thank you, Mr. Chairman. At this juncture, I just want to appreciate Dr. Joseph Sunday, the HOD of Jos University Teaching Hospital Pharmacy Department. Please can I put our hands together for him. I also like to thank our speakers, Dr. Bello and Dr. Adetutu. Please can I put our hands together for them. And our lead discussants and panelists, Pharmacist Atahiru and Pharmacist Njoalu. Please can I put our hands together for them. And for all those who have made our time to be part of this plenary session, can we put our hands together for ourselves? After the plenary session, we'll be having comfy meeting. After the comfy meeting, there will be council meeting by 7. Council meeting is by 7. All secretaries, state chairmen should be part of the council meeting. Thank you so much. We did start with prayers. I'd like to call on somebody to close today's program with a word of prayer before we leave. Anybody inspired by the Spirit to pray for us? Anybody inspired by the Spirit? I remain yours, Pharmacist Akeli Kunu Gabriel. Thank you so much.
We thank Almighty God for bringing us to the end of this highly successful session. We've learned a lot and we are still learning. We pray to him that, we pray to him that all we have learned this evening, we'll be able to, make the best use of them to the best of, to the glory of Almighty Allah. Bismillahir Rahmanir Rahim. Alhamdulillah Rabbil Alameen. Ar-Rahmanir Rahim. Maliki Yawmiddin. Iyyaka na'budu wa iyyaka nasta'in. Ihdina siratal mustaqim. Siratal ladina alhamta alayhim. Ghayril maghdubi alayhim waladdallin. Amen.
Thank you, sir, for that prayer. Our program tomorrow begins by 9 a.m. No African time. 9 on the dot, we are beginning. If you don't come on time, you would have missed out of the scientific session tomorrow. So be here by 9 on the dot. Leave your hotel room at 8:30, please. Thank you for your time.